Ross Simpson. I'm a clinical cardiologist at the University of North Carolina. It's all about the heart, and it's all about really trying to prevent heart attacks and strokes.
What are you seeing with most guys who come to you? Like, are they coming, is it too late? Is it preventative? For the majority of people who come to you, men that come to you, what do you see?
It's too late. I see some men who are very health conscious, but they're the minority. Men are higher risk than women for a heart attack at a young age. We don't know why that is, but men tend to have their heart attacks 5 to 10 years earlier than women do. Women and men have almost the same rate of heart attacks overall, but women have theirs, like I said, 5 or 10 years later in life. So it's serious for women, but for men it's devastating. And men are vulnerable, probably because of poor lifestyle choices and other factors. So basically, not as well managed blood pressure, not taking their medicines, not seeing doctors frequently. So I think we're the vulnerable group here. Well, I think for all of those groups, the most important thing is exercise. We're learning that exercise makes a real difference. And it doesn't always mean exercising, going to the gym and running marathons. It just means being active, walking, running, doing things that are appropriate for their age in life. And everybody should be exercising. I think next important is having a sensible diet. You know, you can't live on red meat alone. Eat your vegetables. It's not a joke. So I said diet, I said exercise, and then make sure, I'm assuming you're not smoking. Smoking is the one thing that really changes everything. If you smoke, you're really increasing your risk of a heart attack substantially. We're talking tobacco smoke in any form, or tobacco chewed in any form. It's not clear if it's just the nicotine or some of the other products, but tobacco absorption from any route is clearly related to your risk of heart attack. The good thing about smoking, and there is a good thing, if you stop smoking, your risk of a heart attack returns to normal within 2 years. So you know what's the most important thing if you're smoking to stop?
So even chewing, which chewing. You have to be conscious of our audience. We're in North Carolina.
Right,
chewing and dip.
Same thing.
Wow.
Yeah, I mean, you're not going to get the lung disease, but you'll get the cancer in your mouth and lips, and you'll get the same risk for heart attack.
Oh my God. Yeah. How soon should you be asking these questions about your heart health?
I think do it right away. The reason for this is, one, is that you catch something early, you can deal with it with diet, exercise. You catch it late, you're definitely going to be on medicines. And the second reason is that we're learning that these genetic forms of high cholesterol, the family history, so for example, if I may pick on you for a second,
please.
Your dad had almost certainly familial hypercholesterolemia because of the high, having a heart attack at a young age.
Sure. What does
that means that you have probably about a 50% chance of having the same gene. And so you need to get your cholesterol checked. The point is that these are numbers you can check. I mean, if your cholesterol is fine, you don't have that gene. And that cholesterol gene is real common even in people who don't have a family history. It's probably present in about 1 in 200, maybe 1 in 300 people. This is a common genetic abnormality we have in our species. And you need to know that. If you've got that gene,
sure,
you want to know it and get on the case right away. I see young people who do come into clinic, and they have the bad gene, but you can manage it with low doses of medicine or no medicine. Whereas if I see the same person in their 40s, 50s, or 60s, they're really on medicines, high-dose medicines, and sometimes they're on advanced treatments, including shots for cholesterol or a blood washing technique we can do at UNC to get the cholesterol down. Well, the technology really, really is good now. We have a spectrum of treatments. It ranges from, for example, the diet program we recommend now is basically, they call it a Mediterranean diet. It's really just a balanced diet. It's not a super low-fat diet. It's low in carbs, but not super low. You can eat ice cream every now and then. It's not a really bad diet.
Eating a balanced diet will save your life.
Yes, and it's a fun diet. It's nothing. It's not In fact, they don't even like calling it a diet anymore. It's just it's a habit, a lifestyle, of just eating foods that are kind of fun. And so the diets are better. The exercise programs are better. We're here. You don't want to advertise this, but a Fitbit works great.
I would
It
too.
works great. It reminds me, Ross, you didn't exercise today. Go take a walk.
Exactly.
It's easy. And then the medicines are better. We have the statins, which I talked about. That's the Zocor and Lipitor, the Crestor. They're great. They really are good. We have other medicines that are incredibly safe. And now we have, for the people with advanced high cholesterol, we can give them shots. They're the Repatha and Praluent. They're the medicines that really lower cholesterol dramatically. They can take a cholesterol of over 230, a bad cholesterol of 230, and bring it down to 80. Really miracle reductions. Just one more thing I'll talk about,
please.
And that is high triglycerides. It's a part of the cholesterol picture, but many men, particularly hardworking guys, work hard out in the sun, work hard, drink a lot of soda, a lot of sweet tea, and their triglycerides go through the roof.
So sweet tea's gonna kill me.
It'll kill you. It really will. And that's a North Carolina phenomenon. It's you don't want to drink your carbs. You have to, and the carbs are crackers, nabs, sweet tea, Pepsi, Cokes, pasta, mashed potatoes, fried potatoes. They're all good in small quantities, no problem at all. But if you're doing that a couple times a day, your triglycerides are going to be up, and you won't lose weight, and you get into trouble. The meds won't work unless you get your diet under control. And the diet under control is that simple. It's really, don't drink sweet tea, don't drink your Cokes or Pepsis,
Right.
Don't drink things that have sugar in them, and you'll lose weight. You'll feel better.
100%. I mean, drinking water.
Just drink with water, and make yourself drink the water if you have to, and then walk. You want 6,000-10,000 steps a day at least. If you do that, you will lose weight. Your triglycerides will come down. You don't need medicines, and what a good deal!
Absolutely.
So
the greatest preventative care: get rid of all the sugary drinks.
Yeah.
And drink water and exercise.
And you don't even have to say exercise. You can say walk. If you just walk, it makes a big difference. Yeah, if you want to exercise, that's great, of course. It's better than just walking. But for most of us, get one of these step counters or Fitbits, something like that, and just make it, let it guide your life a little bit. It's a good deal. So, thank you.